I chose GYN Oncology because it allows me to not only use all of the medical knowledge that I learned while I was in my medical training, but also perform surgery. I fell in love with it when I was a third-year medical student. The first day on the rotation, I knew that this is what I wanted to do for the rest of my life. I love the patients. I love pelvic surgery and pelvic anatomy. I love the amount of cancer chemotherapies, targeted therapeutics that we get to do and learn about every day. It's the one thing when I was going through my medical training that I never minded getting up earlier than my alarm was set or staying way after when I was supposed to get home. And I knew that that's why I wanted to do this for the rest of my life. My philosophy for patient care is practicing evidence-based medicine with a focus on their quality of life while treating the whole cancer patient. In addition to treating their cancer, I also focus on other aspects of a patient's care, including their nutrition, menopause symptoms, sexual health, the psychological aspects of cancer treatment, such as anxiety and depression, and also palliative care with pain management and transition to hospice care when it's needed. My educational background is that I graduated from St. Andrews Episcopal School in Ridgeland, Mississippi. Then I went to Vanderbilt University in Nashville, Tennessee for my undergraduate degree. I did medical school at the University of Tennessee Health Sciences Center in Memphis, and then completed a residency in obstetrics and gynecology at the University of Alabama at Birmingham. I did my fellowship back in Memphis at the West Cancer Center, where I did a year of advanced pelvic surgery and then 3 years of gynecologic oncology. My passion within gynecologic oncology is minimally invasive surgery for GYN cancer, including use of robotic surgery and the sentinel lymph node technique to take care of endometrial cancer patients. I also like to spread awareness about cervical cancer prevention with the HPV vaccine and frequent and regular pap smears for patients to try to prevent cervical cancer. And then I also love the critical care aspects of my specialty and palliative medicine. My mission as a physician is treating the whole patient with a focus on communication and patient-centered care. One thing that I would like for patients to know about me is that even though I feel like I'm a Southerner, I was actually born in Denver, Colorado, and I've been skiing since I was about 2 years old. Another interesting thing is that even though I go by a double name, it's not a Southern tradition that you would think of. Apparently Laura was a very popular name in 1985, and in Denver, me and 5 other little girls were named Laura in our neighborhood, and so we had to go by our first and middle names to be able for our parents to identify us on the playground. And so I have gone by Laura Becca ever since, and that's what I prefer to be called until today.